Hi, everyone. Welcome to the kickoff of a new year of webinars. This is the first Cure CMD webinar of 2024. This is our Cure CMD support for Caregivers webinar in honor of yesterday, February 16th, being National Caregivers Day. I'm Avery Roberts, and I work in community outreach and engagement for Cure CMD. I'm here alongside Kelly Berger as well. Thank you all again for joining us today. It is through our caregivers' devotion and commitment that our CMD affected individuals receive the care and support that is essential to fulfilling their needs and an active lifestyle. What you can expect during today's webinar is a focus on supportive methods to offer quality care for a loved one affected by CMD. You'll learn tips and strategies for overcoming day-to-day challenges of caring for someone with a rare complex condition. This webinar is being recorded and will be available on our YouTube in the coming days. There will also be an audience Q&A towards the end of the webinar, where you can ask our informative speakers your questions. So we will be utilizing the Zoom Q&A feature during the webinar. Feel free to either save your questions until the end or start entering them into the portal at the bottom of your screen. So now our speakers, we have NICHOLE GOBLE, the Director of Community Initiatives at Caregiver Action Network, Emily LEMKE, the owner of the Caregiver Compass, as well as a rare disease parent and caregiver herself, Dr. Robert Graham from Boston Children's, and then Megan Nolan, CEO and editor-in-chief at Rare Parenting and Rare Disease, is a rare disease parent and caregiver herself. We so appreciate you guys being here with us today. At this time, I'm going to pass it over to NICHOLE to touch on finding your tribe.
Hi, my name is Nicole, and so basically what I would like to do is just kind of give a little bit of context in terms of Caregiver Action Network and the work that we do in supporting family caregivers, specifically family caregivers of loved ones with rare diseases. So let me, I guess, a little bit more formally introduce myself. I am the Director of Community Initiatives at Caregiver Action Network. I'm also someone with a rare disease. I was born with Turner syndrome. And in addition to that, I am a caregiver. I'm a long distance caregiver for my mom with lung cancer and COPD. And I was also a caregiver for my grandfather who had bone cancer. So, along with a lot of my colleagues at Caregiver Action Network, um, we really come to this work with, these personal connections. So, a little bit about us. We provide supports, services, and resources for the over 90 million family caregivers in the US. We also think about some of the different categories that these family caregivers fall into. So there are folks that all of a sudden realize, oh, I'm now a family caregiver. I'm now in this role. And they will come to us saying, hey, uh, we just need new tools. We need new supports. So many things change along a caregiving journey. And so it's always important to have your kind of caregiving toolbox well equipped. There are folks that are balancing and being a family caregiver, and that can come with some really unique challenges and stresses. Now, as I'm going through a few things, I do want to kind of give a quote unquote disclaimer. A lot of the things that we discuss and we touch on are more, I think, in terms of generalities, and you may not be thinking about, oh, this automatically applies to my specific caregiving situation. But, I think it's important to think about, well, how might this apply to my specific caregiving situation? And also keeping in mind how, again, caregiving situations are always evolving and changing. So I want to go through some of the pain points of being a rare caregiver. Again, some of these are going to be things that familiar with, but I think sometimes talking through them is really great and kind of grounding and kind of connecting us all together. Once your loved one has gotten a diagnosis, one of the challenges may be finding that information, being able to find information about your loved one's disease, if it's a rare condition. Also, options related to treatment or management. In seeking out this information, collecting this information, you need to become the expert. And this can mean telling others, informing others, educating others about the disease and condition, and access to community. Now, we're all here, we all have kind of a connection to this community, but it can be really hard to find things like support groups or just to be able to connect with others that are caregivers. So just to go over some few pain points that are shared by all caregivers, because again, one of the ways that we think about, when we're talking about disease and condition specific resources that we share, we kind of think about it in, about 90% of the resources and supports and services that folks are looking for are really going to be applicable to all caregivers. They really touch on some of the struggles and difficulties that all caregivers experience. And then there's that 10%. Again, this can be a little bit flexible, but it's about that 10% that really does speak to some of the unique challenges that, depending on your loved one's, uh, disease or condition or health situation, that are going to be, you're going to need some additional supports. But some of the kind of unifying pain points are balancing work and caregiving duties. I touched on that a little bit ago. Time management, making it all work in a day to day. Our schedules, our plates can become very, very full. Role overload, kind of connected with that time management and balancing of all of those duties, feeling like you're taking on so much and not sure how to make it all happen. And of course, finances. Caregiving can come at a cost financially, and there's a lot of out of pocket expenses that can be associated. And even if you have like really great insurance and you're kind of in that spot, there's still a lot of things that can be draining on those finances. And so those are kind of pain points shared by all caregivers. So let's talk about practicing some self-care, because one of the ways to navigate some of these challenges, which is sometimes a difficult thing for caregivers to understand, is building in some self-care. So what is self-care? Prioritizing your physical, mental, and emotional health so that you can be there for your loved ones, so that you have kind of the strength to continue to be there and care for your loved one. So another way to think about self-care is, I'm going to go through what we call our 10 tips for family caregivers. And I think as I walk through them, you'll be able to make the connection of how these fit within self-care and how they kind of relate to navigating some of the challenges that we talked about earlier. So, seeking support from other caregivers. One of the things that I've learned in my role here at Caregiver Action Network is that caregivers want to hear from other caregivers, and that's why I always like to share my caregiving situation. And I also like to share the fact that I am someone with a disability, because I think that that helps people make that connection, understand your perspective. And again, it's about building that community. We want to hear from folks that have some kind of lived experience that maybe we can associate and connect with. Taking care of your own health If you are not in a good space physically, mentally, emotionally, it's going to make caregiving all that much harder. And depending on the circumstances, it can make it impossible. You become the person that needs care, and you're not going to be able to be there for your loved one. Accepting offers of help. Um, Help is seen as kind of a dreaded four-letter word, especially as a caregiver. We want to feel like we can take on everything ourselves. And there's some complicated feelings that come with, realizing that, hey, we do need to ask for help. But it's important that, yes, ask for help when you need it. Learning how to communicate effectively with healthcare professionals, such a challenge, especially, if you are just at the beginning of your kind of caregiving journey. Building that relationship with doctors so that they know that you are a source of information when you're in those doctor visits with your loved one. Because again, it's not about, speaking over or speaking for your loved one. It's about being that advocate for your loved one too, kind of being that amplification for them when they're having those doctor's appointments so that your loved one is getting the care that they need. Being open to new technologies. This is something that's always just kind of changing, evolving. I feel like, every month I hear about, two or three new apps or something that is so beneficial to being a caregiver. Think about your caregiving situation. Think about, oh, it's so hard to do X, Y, or Z. It's becoming more difficult because I've had this change in my schedule. Maybe there's some technology that can be really beneficial to you. So, thinking about mental health, watch out for those signs of depression and other kind of impacts of caregiving on your mental health, anxiety, etc. One of the tools that we have on our website is kind of an assessment tool that we worked with Mental Health America to develop. And so, if you're feeling that, some of these things like, some of these emotions are normal, we feel them, but we're able to kind of navigate them, manage them a little bit, and still kind of continue on with our day. But if you find that you are in a place where you're not able to do that anymore, it's important to seek, some professional intervention. And part of that can be starting with that assessment so that you have some ways to talk to your own healthcare providers. Taking breaks, respite, as is often referred, organizing medical information so that's up to date and easy to find. Now, how does this relate to self-care? And why is this something that's so beneficial and practical? Being organized, having everything kind of together just makes, you know, tense moments a little bit better. And kind of connected to that are legal documents. So, specifically in talking for folks that are caring for, maybe older loved ones, having things like power of attorney, living wills, things like that. And then one of the things that I think we often overlook is just giving ourselves credit. Um, Caregiving isn't easy, and there's really no right or wrong way to do it as long as you're there, you're caring and supporting your loved one, and again, being kind of that amplification, that advocate. So I want to talk more about asking for help. And I think that this, again, when we're talking about community, I love the phrase finding your tribe. I think about the extended care team as really being part of that. Um, Once again, it's important to realize that everyone needs help from time to time, caregiver or not. We all, just as people existing in the world, we all need help from time to time. And it's okay. We can lean on each other. One of the reasons that specifically caregivers can have difficulty in asking for help is that it can feel like you are letting your loved one down. you feel like you've fallen, short of what your expectations are, of what your duties are in caring and supporting your loved one. But that's not the case. You're doing the best that you can. And asking for help is simply making sure that your loved one and you are are getting the support that you need. Now, this is something that I deal with all the time, personally, but I think is something that, maybe we can all relate to. When someone asks us, "Hey, how are you doing? Is there anything I can do to help?" Um, we can sometimes look like, that deer in the headlights and not know how to respond. Um, but especially if these are members of your care team, other family, friends, people that are helping care for your loved one, um, they want to help. They want to be there for you. Oftentimes when we get asked that question, we're like, "Nope, everything is good. I'm fine. Thank you so much for asking." But that's often because we can't think of things in that moment. One way to kind of navigate this is making a list. And this kind of combats two different issues. One is that we'll have some things that we can refer to, right, when we get asked that question, but it helps us really assess the areas that we do need some more assistance. All right. So I've gone through a lot of kind of things that are really beneficial, but I really want to hone in on a few resources that are beneficial here as well. So at Caregiver Action Network, we have what we call the Family Caregiver Toolbox. And so as you can see, we have it broken down into what I think are some pretty great categories so that folks can really find what they're looking for quickly. So if you're wanting information about, balancing work and caregiving, we've got a category for you. If you're new to caregiving and you're like, "I don't know where to start," we've got that as well. So um, it's a really, really great place to kind of start, and it's really, a central hub of all of our resources. We also have the Caring for Rare Caregivers website. And so as you can see here, and kind of like this little title bar here, we have it broken down into some specific categories that really seem to speak to folks that are caring for a loved one with a rare disease. And one of our, I think, huge resources is our caregiver help desk. It's kind of what it sounds like. Think of it like a customer support line for family caregivers. Is where you can get that one-on-one support. So again, going back to that idea of, if there's this pie and 90% of that pie are things that, general resources, supports, and services for family caregivers um, are kind of navigated with stuff that you can easily find. You can still have some additional questions or need some additional guidance that specifically speak to maybe that 10%, finding some of those specific and more difficult to find resources. And so the Caregiver Help Desk can provide some of that one-on-one support. You can reach out by phone, obviously, but if you go to our website, you'll notice that we have a little orange button on the bottom left, and it's a chat feature. It is Monday through Friday, 8 a.m. to 7 p.m. Eastern. But if you reach out via kind of any of the mechanisms, I think you can also email, and you'll see this on the title bar of our website. They are really great about getting back to folks within, 1 to 2 business days. So you can leave a voicemail. If you're using that chat function, it will send that chat message. It's an email. It's all really, really beneficial. And here's some information to stay connected to Caregiver Action Network.
Thank you, Nicole. We do have to wrap up your section just because we are over a little bit and we gotta move on to our other speakers. But thank you so much for your insight, and we look forward to the Q&A. All right, next we are going to hear from Emily on her product, the Caregiver Compass, as well as our recently announced Cure CMD edition.
Hi, everyone. Thank you so much, Cure CMD, for having me today. Thank you to Rachel and Avery and Kelly for organizing this. I am really excited to be here with these other great speakers. So I'm going to talk to you about the Caregiver Compass. It is a resource that I created about a year and a half ago. My name is Emily, and I am a caregiver. I am a rare disease parent. I'm a preemie mom. I'm a NICU mom. And my journey started when I started my master's program at the University of Maryland School of Social Work. I am a licensed social worker, and we were very fortunate to get pregnant my last year of my graduate program. And so there I am 2 days before I had an emergency C-section, and my entire world turned upside down. Then we moved to the NICU. We were there for 97 days. There's my daughter. She was there for a very long time. It took a very long time to get her to come home. She was undiagnosed at the time, and she came home with a feeding tube. And when she came home, they gave us a bunch of different bags of equipment and a ream of paper to take home with all of our information in it, and all of our appointments and everything were in there. And they said, it's fine. You just go home, you'll be good. So she had a feeding tube. I started Tiny Tubie Shop, which is another one of my businesses. I make little feeding tube belts and little pouches and that kind of thing. You can find my stuff there as well. And then in 2019, we joined the Rare Disease Club. My daughter was 18 months at the time, and she was diagnosed with a rare genetic disorder called Coulon-de-Vries syndrome. And that really helped us kind of figure out what to eventually do with her. And for the last 6 years, I've been her full-time caregiver. I take to her all of her appointments. We spend a lot of time in the car. We are always going to therapy. We are always seeing doctors. We are at the emergency room. We are all over the place, as I'm sure all of you caregivers are familiar with. And then in summer 2022, I created the original edition of the Caregiver Compass. I created something called the Medical Mama Compass. And I'm just going to tell you a little bit about it. So why would I create this book? So we were at Children's National, Washington, D.C. We were there for 97 days. Here I am on day 56 with my daughter, still trying to figure out what's going on. How come she's having such problems eating? She had already had 3 surgeries at that point. There was just a lot of unanswered questions. And I lived there with her for 97 days. I slept on the pull-out couch. We're all familiar with the couch and that chair. I was there with the lights on. I showered there. I only went home, once or twice a week to try to get a couple things for laundry or some snacks and to come back. I ate the food on the tray. I was pumping. I was doing all that stuff. I lived there for 97 days. And on day 96, they said, hey, she's doing really great. I think we're going to send her home tomorrow. Do you feel ready? I mean, I guess I felt ready. I didn't really know what to do. She had always been attached to so many wires. There was always constant supervision. There was the monitor. There's all this stuff going on. But I guess I felt okay. And like I mentioned, on day 97, they wheeled in garbage bags, shopping bags worth of medical supplies. They handed me a giant ream of paper, her discharge summary. They had all of her appointments and specialists and phone numbers and everything that's been done and all the doctors that we had seen and all the notes, that everything that had gone on for the last 97 days. And I'm trying to reiterate that I was there for all of it, but I was so overwhelmed. I felt so overwhelmed to go home with this tiny 4-pound baby that had always been under constant supervision. And I just felt so overwhelmed. So they handed us the shopping bags of the stuff, and they handed us the bazillion pieces of paper, and my husband had the IV pole slung over his shoulder, and we're carrying all of the stuff out to the car, and we're carrying my daughter out in her little, bucket, and we are terrified because we don't know what to do. We do not feel organized. We do not feel prepared. And I was there with her since she was born, but I still did not feel prepared. So I decided to create this book because if someone would have handed me this book the day before we left, on day 96, on day 95, even the morning of, and said, hey, you know what? There's some good information in here. Why don't you take a look? And if you have any questions, I can help you. Like one of the nurses, we had great nurses. They were all great. The doctors were great. Everyone was great. Why don't you take a look and tell me if you have any questions? If you have questions, we can help you kind of answer those questions before you go home with this tiny little baby that you don't know what to do. And she's got a feeding tube, she's got all of these other medical equipment things. Someone would have handed me the book that I made, I would have felt so much better. And I'm on a mission to make caregivers feel better before they take home a tiny little baby. So what is it? It's a notebook. It's spiral bound. I was really excited to partner with CMD to create their own personalized version, but it has everything that you need in it as a caregiver to help take care of one of your loved ones. So like I said, I had originally wrote it for my daughter who was a baby, but I've also had a lot of people use it who are caring for older individuals, grandparents or parents who are aging, maybe in a nursing home and that kind of thing. So there's lots of different trackers and everything like that. And I will just kind of tell you a little bit about it. This is the table of contents. It is very thorough. Like I said, I am a social worker. I am a solutions focused person. And like everything that Nicole just went through, all of these challenges and all of these different problems that we have, and all of these different things that we have to think about, the mental load of caregiving is a lot. So I really tried to incorporate a lot of that information. Like I also said, my daughter is medically complex. She has a rare disease. So I know what needs to be in here. I've lived this life. I live this life now. So I understand a lot of the different things that we think about as caregivers. And I really have tried to incorporate this mental health component because I am a licensed therapist and I do want everyone to take better care of their mental health. And it is so challenging for caregivers to find the mental health support that they need through therapy or groups and that kind of thing. So I feel that organizing the information helps remove some of that mental load so that way you can pass it off to different people who help with care, whether it be a spouse, a partner, whether it be grandparents, whether it be a nanny, a babysitter, respite care provider. That way you have options for when you're ready to take a little break. So here's some of the table of contents. This is the main page. This is for the complete edition, which is what the Cure CMD version is. There's one of these pages alongside the calendar on every page, and I'm most proud of this because I've divided it into a care for your loved one and a care for the caregiver. Because just as much as we spend time caring for our loved one and all of the different things that we have to think about with them and worry about with them, we also have to spend some time caring for ourselves. So I've included a lot of different things that I think about regularly with my daughter, some things that we're working on in therapy, some things that we're trying, these emerging goals, some things that you're striving to get to, things that we're going to keep practicing, all of the medical and health information, just little notes about call to refill the prescription. Make sure you ask the cardiologist about this. You know, we have a follow-up coming up in 3 weeks. Do I need to do any labs or something ahead of time? Just little notes that you can write to yourself as you think about them throughout the day. So that way it's not stuck in your brain. It's out on paper. And that way you have a better way to control some of the things you're thinking about. And the care for the caregiver is also very important because maybe if you notice that you're feeling really crappy and you haven't taken your meds in 3 weeks, that might be a good way for you to remember to do that. So check off the boxes as you go. You can also kind of track your stress level and your energy level, which is really helpful to trying to find some different trends. There's also a space to keep track of caregiver care time. Even if it's 10 minutes and you get to be by yourself and have coffee on your own in the morning and listen to your favorite podcast or listen to the news or something, that 10 minutes that can help you refresh and kind of re-energize you can be really helpful in just maintaining this marathon that we have as caregivers. There's also some personal goals for you, some ways to nurture yourself, different reminders and to-dos. And the last thing is on each one of these pages, there is a different caregiver prompt. Some of the prompts are more directive oriented. So, you know, go to the emergency preparedness section and make sure that you've filled out some of the things that Nicole was talking about. Make sure you've got like contact information set. Make sure you know the hospital to go to, the closest hospital. You know, is there emergency meds? Do you know where those are stored? Have you moved them? Are they up to date? Those types of things. And then some of them are more reflective in nature, more of a mental health type spin. So it could be, you know, what would you, if you could go back in time, what advice would you give yourself when you first became a caregiver? If you could, if you had 3 wishes, what kind of things would you wish for? How has caregiving changed you? Some more like reflective type questions that are good for just kind of self-care and reflecting on how you're feeling as a caregiver. These are screenshots of some of the pages. Well, no, these are screenshots of the pages that are within the book. So there's lots of pages for keeping track of medications, keeping track of different testing and procedures, different hospital trips and admissions, health changes, changes in whatever. You can track your own. There's growth charts. And the reason I've included all of these trackers is because to me, data is advocacy. This is a way you can prove your case to some doctors who don't want to try XYZ procedure or XYZ medication or XYZ treatment because they don't have enough evidence. And when you get to the appointment, you actually can't really remember anything about why you feel like you need this. But if you say that, you know, they've had this thing, this symptom happen 5 times in the last month, and then the following month it was 10 times, and the following month it was 15 times. That is advocacy. That is how you're going to get what you need from your providers so that you can best care for your loved one, whether it's your child, your parent. Data is advocacy, and tracking this information is really important to being the best caregiver you can and getting the care that you need for your loved one. There's also an entire chapter on insurance, because we all know that insurance is on speed dial for us, getting those claims adjusted, making sure that claims are getting paid, you're getting those reimbursement checks, making sure that the explanation of benefits is correct. Once you've met your deductible, which I mean, for me happens in the first 5 minutes of the year, but you know, like you have to make sure you're keeping track of these things. There's spending, so you can keep track of those things. There's also some areas for you to keep track of receipts and those things, so that way, when it comes to taxes, you're able to put it all together and it'll be all set and ready for you to go. There's caseworker information. There's changes in benefits and programs, especially if you receive a lot of programs through the state or through federal programs or grants like that. You can keep track of it there. I also, just like Nicole was mentioned, I have an entire chapter on emergency planning, this emergency packing list for when you do have to go to the hospital and you have to leave in 5 minutes. That way you have everything there. You know what to do. You can hand the book to your spouse and say, listen, I got to go. I'm going to pack some clothes. Can you please make sure that I have my phone charger, my toothbrush? Can you help me with this? Hand it to someone else who can help, or keep something by the door so that you know you can just grab it and go, especially if it's an emergency. Hospital packing list. Something else that Nicole mentioned is, what can I help with wish list? This is just a great thing for you to have up and ready if someone asks you, hey, what can I help with? Just being able to say, you know, I think we're going to have to be inpatient for the next week. We really like to get takeout from Chipotle while we're there because it's just down the street. Do you think you could bring that to us? Or can I have a gift card or something? Or could you order it for me on Uber or DoorDash or something? Your friends and your family want to help you. They don't know how. So sometimes having very specific things, we order from this place when we're inpatient, or, you know, could you pick up my other child and drop them off at school on Thursday morning so I can take my medically complex child to their therapy appointment on Thursday? Very specific things. That way you have a list, you're ready to go. If someone asks you, you know what to do. Emergency contacts. And then lastly, there's a medical emergency plan. Knock on wood, something happens, they have a seizure, they have some type of allergic reaction, they fall and break a bone, their medical equipment, like their wheelchair malfunctions. Who do you call? What do you do? Where do you go? How can you help? There's a power outage. Oh, so important, especially, you know, weather, all this weather stuff. There's a power outage. You don't have any fresh water. Your car won't start. Make a plan ahead of time so that way you know what to do when things are not going very well. There's an entire chapter on education. Now that my daughter is school age, this is something that I am really focused on, but there's IEP information. This is, of course, optional. You can adapt it to make it be whatever. If you have an older loved one, you can cross it out and write something about assisted living or, you know, their adult day program or something like that. You can adapt this to be whatever you need. It's just paper. It's just paper. You can make it to be whatever you want it to be. There's a whole chapter on equipment. This is really good, the equipment information. There's a place to write the serial number down, the part number. So that way when you are calling the manufacturer and they say, what's the serial number? And you don't know because your child is at school who has the wheelchair. Well, you don't know because it's there. I don't know. I can't look it up. So there's just a place for you to keep all this information all together. There's also some places for appointments, of the upcoming appointments. And then lastly, the medical team and any provider changes. And then also there's an appointment log, and there's like 40 pages of appointment logs because I actually tracked all of this before I published this book because my daughter has that many appointments. So it's great because you can group it by specialty. So she has all of her cardiology appointments all right in a row, going back from 2019 to present day. And, there's like 20 of them. So she's got all of her cardiology appointments right in a row. She has all of her neurology appointments right in a row. And it's really great because you can see over time, you can track over time, you have that data. That way you can advocate what's best. We've tried these interventions. We've tried these different treatments, all of it over time, tracking it all in order, keeping it all together. So that way you can see over time what has worked, especially for each specialist, especially if you're going to end up change doctors, change hospital systems. It's just really nice to have everything all together. There's also a list of medical specialists just for reference. There's also a medical advocacy tip section of how to talk to medical doctors and medical professionals about advocacy and trying to get what you need for your loved one. Like I said, I am a clinical social worker. I am big into mental health and feeling. So this is something you can kind of just reference to see how it is you're feeling about it, because caregiving is complicated and there's a lot of things that go with it. Lastly, there's like an adulting section where you can put responsibilities. There's different due dates. Keep track of your car, keep track of your house cleaning, just like more of like a journal, like preparation. Finally, there's some different plans that you can make over the course of the year. There's just blank pages for you to write travel ideas or projects you want to take on, or summer things that are going to be happening. Holidays are extremely stressful, can be extremely stressful and challenging as caregivers, because a lot of people don't understand that this could be a very grief-filled time. There's just a lot going on. So there's just some blank pages that you can add everything there. So you kind of can make a plan ahead of time. And then here's some of the self-care, mental health portions as well. There's ways to do self-care, celebrating the inch stones, and making sure that you're able to really appreciate all of the things that your loved one has been able to do and will continue to be able to do, even if they're not a milestone, they're still an inch stone. There's space for inspiration and mental health. I have an entire feeding tube chapter as well. Oh, okay. Sorry, that's a lot. But anyway, there's a lot of things jammed into this book. I am so thrilled to be working with Cure CMD for this partnership. There is a really lovely letter from Rachel in the inside cover for this, and this is the special edition. This is what it looks like. It is the complete edition, so it has all of those caregiver prompts at the end, and it has the care for them and the care for the caregiver columns, like I talked about in the beginning. I have some that I can ship next day, and you can save 15% with the promo code CureCMD15 if you go to thecaregivercompass.com. So this is the link. Here is some of the feedback I have received from different caregivers who have used it. Like I said, I launched this in summer 2022. I have gotten such great reception from everyone who has used it. I'm just so grateful that this is working out and it's getting into the hands of people who need it the most. That's my mission. I don't want anyone to have to go home from the NICU with a ream of paper and feeling so overwhelmed like I did. It doesn't make any sense. We can do better. We can take better care of our caregivers. Here are some of the people I've worked with, some of the organizations and the groups that I've worked with. I'm in hospitals, I'm in NICUs. If you would like to do a partnership with me, please feel free to reach out. I'm happy to customize different books and make it look really nice. So if that's something you're interested in, just let me know. And here is how you can get in touch with me, thecaregivercompass.com. You can email me at any time. And then I'm also on social media, and I would love it if you would follow me. So there we go. Thank you for having me.
All right, now we're going to move on to Dr. Graham, who will take us through navigating complex care with an emergency prepared plan of action.
Right. Well, honestly, I'll be building on what Nicole and Emily have just been going through. And I have to say, Emily, I just forwarded your link to my care team as well. So hopefully you'll be getting a lot of orders. No real conflicts of interest other than to say I've been very involved in the neuromuscular space as a physician provider and as a clinical researcher and just general advocate for a long time. And the challenges that you're facing, I think we can. I learn something new every day, honestly, as I work with families and adults with neuromuscular conditions. I want to thank folks in advance. So Cure CMD, Avery, Kelly, Rachel. I want to thank my team, the CAPE and home ventilation program. And then Basil Doris is the neurologist that I work with. And we've been part of his neuromuscular clinic now for over 15, almost 16 years. So when I think about emergencies, I want to think broadly. So I am a pediatric ICU physician. So I'm the person you do not want to see usually, or if you happen to wind up in my ICU, you're probably who you do want to see. But it's really in my role. I run our home ventilator program. So I currently follow about 400 children and young adults with non-invasive supports, trachs and vents, a lot of complex needs. And, when I'm thinking about emergencies, it's not when they arrive to me, it's about how do we prevent that or anticipate that. And really it's to facilitate you going about living your daily lives and enjoying yourselves. And, how you go about doing that is open to interpretation. So these are 2 speed limit signs. The one on the right is the Autobahn in Germany, and the one on the left is from Montana when I moved out to Boston about 30 years ago. How you interpret reasonable and prudent is up to the individual. And so I think it's helpful to sort of appreciate that in terms of, how you prepare for emergencies. What I think is essential, though, is that, I want to sort of go over phenomenologically and practical issues, is that how you look at yourselves as a caregiver or as an individual with a muscular dystrophy or other conditions, that is probably different than the physician providers or other professional staff that you're going to run into. Is that, things have moved forward in this space, whereas a lot of the providers haven't really moved forward with it or kept up with it. And so it's, how do you confront that? How do you address that and make it work for you? Because things will happen. And I think that's helpful to sort of remember, is that, as much as we try to anticipate, we want to make sure that we are ready for them. So this is literally the tip of the iceberg, and I'm going to go quickly. This is also illustrative. I'm not the smartest person in the room because 90% of the iceberg is below me. But one of the things that I know all of you have probably run into is that you're running into general barriers in terms of the medical system. And when I'm thinking about preparing for emergencies, actually what Emily brought forth with the compass is essential, because educating the team quickly is very helpful. And it's not just a matter of being in clinic routinely. It could be the ER, it could be preparing for surgery. It could be meeting with your IEP team in the school, a lot of different things. And what you'll confront is a variety of professional attitudes, which may not align with where you're at. And that, personal care roles or parental or caregiver roles are very different for those with special healthcare needs. And then there's sort of an appreciation or lack of appreciation that, everyone's path is a little bit different, and that, the trajectories are highly variable. So, yes, I've cared for a lot of people with a given muscular dystrophy, but, you as an individual may have different needs and your experiences and what have you, and that's not always appreciated. And so, unfortunately, you do have to sort of be a squeaky wheel. This I borrowed from the mother of one of my patients, and she used to wear this actually to be a little provocative in the hospital as a t-shirt and hat. She also had bags with it, and I actually told her at one point she could actually substitute MD for RN, RT, PT, OT. She kind of did it all. And I think, it was helpful for people to appreciate that she was the resource for her individual child. Also for the condition, like she has, I think as Emily noted, she probably had as much knowledge or more than most of us about her child's specific condition. And then we've learned a lot, the sort of the population of people with chronic conditions actually probably weathered, fortunately, the pandemic more than some of the general population. And I think sharing those experiences and sharing amongst ourselves is actually very helpful. So, as I said, I think of emergencies as very broad. You might look at this young man and say, why is that day that he was there particularly an emergency? And it was just because, in fact, actually, he was very involved in power soccer, and 2 prior tournaments that he'd been in, he wound up in the ER that evening with vomiting and nausea and inability to maintain his hydration. Now, that was because literally he was spinning all day long and was a bit motion sick. And so mom came up with a good idea, and we worked through, is that, the day before we would put a scopolamine patch on for every other tournament he wound up at for the next several years, and actually really mitigated the need to, well, first of all, made him feel better, but they didn't need to go to the ER thereafter. And so I think it's helpful to sort of just anticipate these things and think, oh, it's just a power soccer tournament. How could that be an emergency? But oftentimes you wind up doing, as I said, it's sort of a DIY or do-it-yourself emergency care. And I think this is challenging as you sort of wind up at different facilities or primary care offices or specialty services or what have you. I have this sort of picture of the hammer and the nail, and that is to say that oftentimes you'll encounter people who say, oh, I know how to take care of a muscular dystrophy, or I have this tool and this is how I'm going to apply it. That you may, for them, their hammer applies to every nail that they see. And that's not necessarily helpful for you as an individual. And it does put a huge burden on. And I think, as Nicole was saying as well, it's like family-centered care or, caregiver, where it is challenging because a lot of the burden is put on you, even when you think I need help. What I would recommend in general is reach out to your primary care. Have a passport or emergency information. And actually that Caregiver Compass is a great model of it. And it will definitely be reaching out. Look at your local and regional facilities. If you're traveling, look and see what's local or regional, and recognize that some of them may be great for you. Others may just be way stations, and some you may want to just drive right past. And sort of figure out, how do you map things out when you're at home or when you're away from home. Look at options and find out in your area. If you're near a big hospital or your primary center, do they have a transport team that can get you from a local hospital to them more quickly, or their specialized teams? Because I can tell you, most of your emergency services are not going to be familiar with, number one, your condition, but certainly any of your equipment or any of your specialized therapies. And then I think, both Nicole and Emily spoke to, having an advance directive, having healthcare proxies, MOLS or medical orders for life-sustaining therapies, having that, sort of mapped out in advance is just a prudent thing. It's painful. It's difficult to talk about sometimes, but I think it's essential for everyone. When you do wind up at a hospital, it is certainly not a time to take a deep breath or a sigh of relief, because in fact, actually, as I said, this is where you are often engaged or need to advocate even more loudly or reach out. Helpful in advance, if you can, have an ED or an ICU care plan. Sometimes we're allowed to keep sort of shadow files at the hospital, and if you're, quote, a frequent flyer, or even if you're not, it can be really advantageous. Bring any equipment and bring your protocols, because having that in advance is helpful. And again, the specific mask, if you're wearing BiPAP or other backup equipment and stuff, the hospital may or may not have that on any given day. And what we saw during COVID is that they were sort of conscripting a lot of things for other patients and other populations, and even sending them from a pediatric hospital to adult hospitals, so things weren't available. Reach out when you're, if you do have an emergency, contact your primary care, your specialist, or whomever you work with. And, I have families who, if they're traveling, it doesn't matter whether they're in the country or out of the country, they're reaching back to me when there are problems. And I'm fine. I want to hear from them because I want to get them into a better spot. There's a lot of variability amongst hospitals. Where does someone with a given diagnosis or a given technology support need to be? And you may need to advocate. It's like, I need to leave this hospital. I don't want to be on the ward. I want to be in an intermediate care unit, or I want to be in an ICU, or you know what, maybe I can do this better at home. And so again, reaching back to who your primary team is can be helpful, because they can advocate for you as well. All of this may seem like a bit of a battle that you're swimming upstream, as it were. And, I think it is challenging. And again, this is where sort of the finding your group, I think, as Nicole was talking about, having people to help you along the way is essential. The ICU, and I think Emily's experience is not a vacation. And I think a lot of families speak to this, and you are having to update everyone while you're there. And again, all I can say is sort of reach out. Most of your providers are not going to know about your condition. They're going to go to UpToDate, literally if you haven't been to it, there's a website called Up to Date, and it's a medical resource where they'll type in, LGMD and say, what's the latest? That may or may not be up to date, and it may or may not be what's in reference to you specifically. But one of the biggest challenges, and I think everyone sort of can appreciate this, is what you are able to do at home and in the community, you're not allowed to do in most ICUs and at most hospitals. And so I think partnering as best you can with the providers there and teaching them along the way, while also learning about, what is it that you can do or what they can show you to prevent you from coming back in, can be helpful. I have a whole separate talk I would love to give at some point about procedures and procedural sedation and anesthesia. I won't get into it a lot other than to say there's no such thing as conscious sedation. And this is of greater consequence for someone with a neuromuscular condition and otherwise. And really and truly, this is something you want to anticipate in advance. Getting sedation for a simple dental procedure or, a broken arm or something like that could potentially be the bigger problem than the underlying issue that you're trying to address. But overall, and I sort of want to wrap up with this, is that, the best defense for an emergency is a good offense, is that, your family, your caregivers, yourself, you are a great resource in just anticipating. And this can be helpful. It's like, my goal is tomorrow to go out skiing with a couple of families with SMA and another one with muscular dystrophy. And, we're there. We know what's available locally. And the hope is that there won't be any issues, but, you have to have contingencies. Community, Smart 911. So you're sort of alerting their community and who are you going to call or who's going to arrive when, if you call 911. The yellow dot you can put on your car, and you can actually just look this up. I've actually learned from a few other families. It helps identify that someone in the car has a special medical need. And so if you're in an accident and if you as the caregiver are not able to communicate that, the individual with the special needs actually may not be able to communicate, but there's sort of an acknowledgement that, yes, we need some special accommodations. Ready.gov has some great resources. And I think, as Emily noted, certainly weather is an issue. Power outages are a problem. And so what are resources you can tap into with generators and other things like that? You can contact your electrical company and your water company and making sure that you're a priority. And then the knock box is something actually as well. And again, some cities have these, some are state mandates or state options. It's actually you mount it on your mailbox or next to your house, and it provides a key that only the fire department can access, so that they don't literally have to break your door down if there's an emergency, that they can actually just use a key, and it's helpful to identify this house as a knock box. Environmental things, yes, home, school, work. Work in advance, anticipate what happens if there's a fire in my building. I've had children, sadly, in wheelchairs that are on the second floor, and when the power goes out, they can't use the elevator. And so they've been put in closets during emergency drills and things like that. That's not appropriate. It's not safe, and it can be terrifying. And so working in advance. Services, again, it's highly variable. We went through a pandemic. A lot of families lost PCAs and nurses and otherwise, have backups, trying to work through various options and get creative. The network, as Nicole was working, as mentioned, is essential. Preventative care. Vaccines are preventative care. Highly advocate for them. I know there's a lot of concerns, but work with your providers and really sort of advocate for that. And yeah, just anticipate. Don't wait for that emergency to happen is sort of the takeaway. Resources, Cure CMD is a fantastic resource. You can look at some of the literature. The problem with some of the literature is that it's not necessarily specific for you, but I can tell you what it will do is get the attention of the medical providers you're working with. And so you can say, here's this, now let's talk about me. And that can actually be kind of helpful. So hopefully we're able to cover a lot in a very short period of time, and you can always email me. I get out and about with a lot of the families that I work with, and happy to sort of be a resource, but also share ideas, because truly that's something that will be essential if we're going to keep everyone happy, healthy, and sort of enjoying themselves.
Thank you so much, Dr. Graham. All right, finally, Megan will give her insights and thoughts on taking care of yourself as a caregiver. I did just want to mention that she's also the founder of the Children's Rare Disorders Fund, which is the nonprofit that her and her husband established to raise funds when they received their son's diagnosis. So I think she'll talk a little bit more on that as well. Take it away, Megan.
Hi, everyone. I am Megan, as Avery mentioned. So first and foremost, I am a parent of a child with FOXG1 syndrome. I formerly worked in marketing, advertising, and magazines at places like Vogue, Prada, and with over 100 brands such as Louis Vuitton, Chanel, Nike, Apple, and so on. As Avery mentioned, I launched the Children's Rare Disorders Fund, and this was just 3 months after my son's diagnosis. And as Avery said, this was to raise money for FOXG1 research. About a year to the day later, I launched Rare Parenting Magazine. For those who are unfamiliar with Rare Parenting, it is a doctor-backed, journalist-written magazine similar to a Parents or a Baby Center for the special needs community. So to begin, I'd like to start with Domenico, because I think each of our journeys really does begin with our child. I have a little video here, actually, for you guys to watch to keep it quick. So Domenico is nonverbal, non-ambulatory. He has no purposeful movements of his hands. He feeds with a G-tube. He has severe epilepsy and many other symptoms, over a dozen other symptoms, such as respiratory issues, swallowing issues, constipation issues, and so on. Before Domenico was diagnosed, life was very difficult for us. I was brushed aside essentially by pediatricians. I was told that everyone's developmentally delayed these days and that crying 6 to 7 hours per day was just colic. Domenico wasn't diagnosed until he was 16 months old, and this was after his seizures began. And we found a great neurologist who suggested genetic testing, at which point it was revealed that he had FOXG1 syndrome. During all of these months, these 17 months, each time we kind of hit a problem, we really didn't have anywhere to turn. We had a lot of trouble finding information online, and he wasn't diagnosed. So we didn't know that we should be looking at rare diseases and at symptoms related to rare diseases. After diagnosis, the cloud did begin to lift. We were able to understand some of his symptoms. We were able to get in touch with some of the right doctors, but we continue to be hit with symptoms one after another. And again, we didn't really know where to go and who to turn to. Luckily, we had an amazing FOXG1 parent group, and they often answered a lot of questions for us. And I know you guys got a lot of information today about these sorts of things, building community and you know, taking good notes and doing all of these sorts of things. This was all crucial to us in the beginning, particularly because there was no other information. And that was really where I began to concept Rare Parenting Magazine. I felt like there needed to be information online that was kind of all housed in one place, similar, like I said earlier, to a parents or a baby center. There should be a parents or a baby center for our community, for the special needs community. And so really that's why I built it. As far as taking care of myself during the first 17 months, it didn't happen at all. I would go a week sometimes without showering. I would go 3 weeks regularly without leaving the house. Self-care wasn't really an option. And I'm not sure of everyone's situation that's listening in today or later watching on YouTube. But what I find with a lot of parents is that sometimes they find the term self-care to be a bit of a joke, like it's a faraway land that they can't really get to. And it's not because people have trouble understanding what self-care is. I don't think anyone here listening doesn't know how to take care of themselves or doesn't know typical tips, right? For like quick ways to take care of themselves. The problem really is just time, because we're all so overloaded. And the reality is you can't take care of yourself if you're too busy putting out fires. You can't take care of yourself if you're rushing your kid to doctor's appointments, if you're learning about new medications, if you're learning about new symptoms and how to manage them, if you're administering medication, and so on and so forth. It all just becomes extremely overwhelming. And I think really the number one piece of advice that I want to leave everyone with today is to get ahead of things by getting educated. So you guys need to be thinking about not just the symptoms that your kid has today, but what are the potential symptoms that your kid will have tomorrow? This way you won't feel like I did all of those months, and really did until just last year. It wasn't until he was about 2.5 until I finally started to get ahead of things. When you're not ahead of things, you're scrambling. You're hit with a new symptom, you don't know where to go. Your pediatrician can't really help you. Your neurologist, if you have a neurologist, can't really help you. In our case, our neurologist can't diagnose a GI issue, right? They're not familiar with GI issues. So establishing that care team I was mentioned earlier is crucial so that you can get ahead of the symptoms. So I would ask everyone listening to meet with doctors that you may potentially need, not just the doctors you need today. Meet with every doctor that you may potentially need, because in that meeting, they will tell you all of the symptoms they cover, what that looks like, so that if your child experiences one of those symptoms, you know who to call, you know how to get a medication, and they may even leave you with some tips of things that you can do at home to treat the symptom while you're waiting for the script, for example, or while you're waiting for whatever the next step is. In getting educated, our perspective really overall is that we become caregivers overnight. We're not given a job description, we're not given any training, we're not given information on which symptoms to expect or how to manage them. So Rare Parenting is here as part of this education piece. We're here to help fill this gap. We offer guidance and direction as you guys seek diagnoses, and manage daily care and living. We exist to lighten the burden. And I hope all of you can turn to Rare Parenting to help lighten that burden. Look at some of our verticals as an example. And of course, there are many more, but we're falling inside the areas of symptoms, advocacy, finance, and self-support. We actually don't call it self-care on rareparenting.com. We call it self-support, because we feel that that's more relevant and more real than maybe self-care. And a lot obviously can fall into self-support. After getting educated, and just so you guys know, I culled down the slides a little bit while we were on this call, since we're so far over time. So I'm just really going to leave you with the two most important things that I'd like you guys to know: get educated and planning ahead of time. So if you're thinking about self-care and you're struggling with finding the time, I don't think trying to throw quick self-care tips on top of your already overloaded schedule is really going to help you. It's certainly the reason why I never paid any attention to self-care. I had way too much on my schedule. There's no way I can also add self-care on top of it. If you think of self-care as if it were a meeting, set a date and time on your calendar for your me time, or even your couples time. Put a date on your calendar, put it out 3 weeks if you need to put it out 3 months if you need to put it out 3 months, however much time you need to make sure everything else is in order in your life, in your child's life, after you've met with all of your doctors, after you feel less overwhelmed. Put that date on your calendar. And from now until that date, start thinking about who's going to come in to help with your kid. Does this date mean you're going to stay at home and someone's just going to come over and help out so you can take a nap even? Or does this mean that you can leave your child with someone so you can get out of the house, so you and your husband can go to lunch or dinner or movie or whatever it is? Just plan ahead. If you put it on your calendar and you find someone to come over to help you, you will keep that date. and you will be able to get in some me time or some couples time. And this is really important, as everyone sort of talked about today. You do need those breaks. You will burn out, and you guys probably are already burning out, otherwise you wouldn't be listening in today. And I think it's just very, very crucial to try to take that time. And the best way that it's worked for me is to make sure that you're planning it out. How to find Rare Parenting. So you can find us on rareparenting.com. You can sign up to our newsletter. And of course, you can find us on social media, Instagram, Facebook, Twitter, Pinterest, and LinkedIn. And that's all I'll leave with you today. We're well over time now, and I want to be conscious of everyone's time, and I want everyone to hopefully stay for Q&A too. So thanks, everyone.
All right, and we did just want to take a moment to highlight some noteworthy resources that may find of use. We will also put these in the description on the video link after the recording is up, so you're able to access that easily as well. And we are going to move on to our Q&A. So as Megan mentioned, we are way over, so we want to make sure that if you have questions, get those in the chat or the portal, and we will get those answered. All right, so we did have one question come in here. So we'll address this to anyone that feels comfortable speaking on the topic. How do you handle guilt if you feel like your self-care takes away from your loved one?
I can chime in on that. So I feel guilty every night I don't sleep with my son. So my son sleeps with me in bed because many kids with his disease die. 30% of them die before they hit age 5. He's 3. And lots of times it happens overnight. So as of about 6 months ago, my husband started taking him on the weekends because I was really crashing and burning at that point. And every single week, like even thinking about it now makes me want to cry a little bit. Every single weekend, I feel guilty that I'm not sleeping with him. But you have to have enough sleep. You have to have the basics of self-care, or you literally can't go on. So it's okay to feel guilty, and it's okay to continue to feel guilty, so much so that you want to cry right now on a presentation. It's normal. You can feel guilty, and you can continue to feel guilty because that's just a sign that you're a great parent. It's just a sign that you love your kids so much, but you do have to put your health ahead sometimes. You do have to make sure that you're surviving. Otherwise, you won't be able to take care of your kids.
Yeah, this is Nicole from Caregiver Action Network. And I mean, I think that's so perfectly stated. I think it's really about changing the way that you think about things as caregivers and realizing that taking care of your own health, your own well-being is so important to being able to provide that care to your loved one. You know, one of the biggest issues with caregiver burnout is that you get to a point where it becomes more challenging than impossible to do some of that day-to-day things, you know, that Megan so I think beautifully talked about. And I think it's, you know, being able to step away and realize it's not selfish, it's not guilty to invest that time, that it's really an investment in yourself and your ability to be a caregiver.
All right, we had 2 other questions come in. We'll get to those. How do you help your family adjust to the idea of hiring outside help? Anyone can jump in on that.
I'd say people have had to get creative. I mean, truly, it was challenging before the pandemic to get supports. It was worse during that, and really we haven't recovered in terms of those who qualify for home nursing, but even PCAs. I mean, I'd say you shouldn't, as it relates to, you know, caregiver, respite, you know, exhaust all your resources, because I think, as Megan said, it's not a question of guilt. It's a question of sort of acknowledging that for sustainability and safety, yes, you should do that. Some states, you know, actually have new, you know, programs for CCAs, so parents can actually even get paid for some of the care that they're providing already. And so lots of different options. Reach out to nursing schools, you name it. There are people looking for opportunities. And there are some you can use for some states catastrophic illness funds. Those aren't, you know, limitless, but they can be helpful. So you kind of have to take the long view. And, you know, for if there are individuals, anyone on the webinar that are going to college, your classmates actually can be fantastic, is that they are often looking for opportunities to make a little extra money, and can, really make your college experience that much better.
And we will wrap up with this final question here. How do you stay patient when you're feeling frustrated so that the person that you're caring for doesn't see that frustration? How do you stay patient?
I'll jump in on this one, as my husband has a lot of issues with this actually, and he's gotten a lot better, I think, over the years. But initially he was very angry. He was angry that my son was so sick, and sometimes it would almost seem like his anger was towards my son, although of course it wasn't. And the way that we managed it initially was to have him leave the room. If you're the primary caregiver and that's not an option because no one else is there, you can probably step away or turn your back, take a few deep breaths, center yourself, and just for a second, remember that in that moment, it isn't really all about you. You're the parent, you have to care for your kid. Your own emotions, like any parent will do, have to be dealt with kind of separately, not in front of your kids. So you do have to almost in a way bottle it up if you're in between a rock and a hard place and you're the only one helping your kid at the moment. You do have to bottle it up and save it for later and work through it later. If you do have someone else there, as I mentioned in the situations with my husband, have the person who's upset leave the room. It's for the best. Let them work things out and then let them re-enter.
I could just add on to some of the things we've already said is I think a lot of these questions just relate to your own boundaries and capabilities as a caregiver. And like I mentioned before, caregiving is just such a complicated and emotional journey, and it really is a marathon. So you need to be able to take good care of yourself so you can care for those around you. So setting up those good and a therapist could help you with this, setting up some good boundaries around what you're able to do and comfortable to do, and what you're able to do with your loved one can also be really valuable. And just kind of finding some of those values within yourself can be helpful. Got to take care of yourself.
I think
Oh.
Avery will go ahead and wrap up with this. Go ahead.
All right, we'll start to wrap up here. I did just want to also add, along with all the many resources out there that we included earlier, we offer CMD community specific support through a variety of formats open to the community. We have a great group of community members who meet for happy hours via Zoom. It'd be great to have you join there, allowing you to get more acquainted virtually with other members as a fun social opportunity. They're a very relaxed and welcoming environment. We also have a program that is designed to help facilitate peer-to-peer conversations, a little more one-on-one. Great to connect with someone or a family traveling along the same or similar journey as you. You can find more info on both of these programs on our website at curecmd.org/community-resources. As Emily mentioned, CureCMD and the Caregiver Compass are psyched to have teamed up for this all-in-one notebook designed to help track all aspects of medically complex caregiving, like Emily went through, for a 15% discount. Use the promo code CureCMD15 to celebrate the launch of the CureCMD Special Edition dedicated to our community. Rare Disease Day is right around the corner. It will be recognized this year on Thursday, February 29th. Around the world, the rare disease community is coming together to show their stripes and raise awareness. As a global community, we have a powerful voice. So we hope you'll join us in celebrating. You can learn more and different ways you can support at rarediseaseday.org. Thank you to everyone for joining us today. Thank you to our speakers. We're so grateful for your willingness to share your expertise on all these different areas. We hope you find value in exploring this information, tips, and resources for caregiving, as well as more specific considerations for providing care to a person with CMD. Make sure to mark your calendars for our next webinar on PCA guidance, April 6th at 1 p.m. Eastern. If you have any questions, please feel free to reach out to us at outreach@curecmd.org. No, this is a lot. We're almost there. Just bear with us. If you find this content valuable, we'd appreciate it if you'd consider a gift to ensure that we can continue to provide these beneficial and supportive resources to our community. You can scan the QR code on your screen or head to curecmd.org/2024 to show your support for CureCMD. It will go a long way in helping us continue the work of our mission. And finally, to keep the conversation going, share with us what you learned today by tagging us at CureCMD on all social media platforms, and you can use the hashtag CMD caregiving. All right, thanks everyone again for joining us, and have a great rest of your weekend.